Bring you the facts and information you need to help you combat or deal with COVID-19. And tonight we are joined on set by the Public Relations Officer of the Trinidad and Tobago Medical Association, Dr. Mohammed Rahman, Special Medical Microbiologist Dr. Rajeev Nagassar, and Ophthalmologist and Medical Doctor, Dr. Akil Hinds. Good evening, gentlemen. Good evening. And thank you for joining us. Let's start at the start. What is COVID-19?
It's a virus, just like how we have genetic material, viruses have genetic material. So this virus has a genetic material called RNA. It has a coat around it, what we call a lipid coat, so a fatty little layer around it. And that's a kind of good because it makes it easier destroyed because of that. It belongs to the same family of viruses as the common cold, as Middle Eastern Respiratory Syndrome and SARS coronavirus. In fact, this virus also, although called COVID-19, is also called SARS coronavirus 2 in the literature. When you look at published literature, you're going to see SARS coronavirus 2.
What makes this virus so special or different or so fared from other viruses like the flu?
Well, this virus has had a high infectivity rate. However, from the published literature, there's not a high mortality, so meaning not a lot of people die and a lot of people getting infected. But it affects persons in certain risk groups more than others. So, and this risk group would be persons who are older, persons who have diabetes, high blood pressure. In the studies that came out of China, and over 500 studies have been published already just in the first 2 months of this year. It's mainly persons with diabetes, high blood pressure, cerebrovascular diseases, and persons over 60.
And Dr. Rahman, how does this virus enter the body?
Well, like most viruses, it enters the body through the mucous membranes. Most frequently, we talk about respiratory tract or droplet infection. So somebody sneezes, for example, then droplets of the virus will make its way across onto any one of your mucous membranes. Perhaps a mouth, perhaps a nose, perhaps the eyes. Sometimes it's as a result of touching a surface on which somebody's fluids have been on, and then you carry on and touch the eyes or touch the nose and you inoculate the body, or you get the virus directly into the body, and that's when the infection starts.
Does this involve all types of bodily fluids?
That's a very good question, and it does appear that quite a few bodily fluids, I'm not too sure about the tears particularly, but it is present in the urine, and the viral RNA is certainly found to be present in stool and in samples taken from the gastrointestinal tract as well. So yeah.
So if tested positive for COVID-19, what really should be done?
Well, the Ministry of Health has issued proper guidance on that, and I think in a time like this, we should depend on what the Ministry of Health is stated, and is basically that we self-isolate if we're asymptomatic. You don't want to have stricter measures like quarantine. Quarantine is where we would have to demand that someone stays at home. If a person is, say, symptomatic, they would have to call the local health facility, like the health center. They may present to the hospital, right? So they may want to self-quarantine, or if they are symptomatic, they may want to call or present to the health center. Once they're called into. It's not a good idea to go straight into the health center because of the fact that you can infect persons with your droplets when you cough or sneeze, especially sneeze.
And what kind of time frame is anticipated for preparing a vaccine?
You want to take this one, Mike?
So for this particular virus, what we've heard from the United States is that it's going to take at least a year to prepare a vaccine. A vaccine could take many years to prepare, 5, maybe 10 years.
But obviously, a particular amount of attention is being placed on this one. But does it really matter how much attention is placed, or is there, there are certain stages and steps that must be taken that require certain time periods that you can't really speed up?
For this particular vaccine, it's actually piggybacking on a MERS vaccine developed by the Walter Reed Army Base in the United States. That's what the U.S. is doing, and that particular vaccine is a DNA-based vaccine, so they already have the technology. So they're piggybacking on that technology, and that's why they can get it out so fast in about a year.
Perhaps to clarify a little bit about that, the MERS virus was another type of coronavirus. So you mentioned at the beginning that this is a coronavirus, and we have experience with coronaviruses before. So we saw SARS in 2002, we saw MERS in around 2012, 2013, and we're familiar with other coronaviruses like the common cold, which is truly a genuinely very mild viral illness generally. So they've been able to piggyback, as you were saying, on the research of the other vaccines, and that's why we may see this one come out a little bit faster, not necessarily because more attention has been placed on it, but because we have the shoulders of giants to stand on.
What about the most vulnerable in society, the elderly, as you would have mentioned earlier, those who have certain immune deficiencies as such, and in particular pregnant women? Dr. Hinds, can you tell us?
So with regard to pregnant women, you're speaking about
yes.
in general?
In general, those that are vulnerable, right. as well as pregnant women.
Right. So with regard to the, we've noted that the elderly population, those that are immunocompromised for whatever reason, be it cancer, on treatment for cancer, for HIV, AIDS, diabetes as well. These patients, these clients tend to be a bit more vulnerable than, to the coronavirus and to diseases in general, infectious diseases in general. And as such, the recommendation, just like from the Ministry of Health, we recommend similar guidelines where we practice proper hygiene in terms of dealing with them. So from an elderly perspective, and I'm here as the medical director for the Trinidad and Tobago Residential Care Association, we suggest to the homeowners that they should have some restrictions and limitations to the number of persons actually entering the homes as best as possible. As well as if one must enter the home as a doctor or a nurse or even the homeowners themselves, you have precautions. So have them wash their hands as they enter the homes, use hand sanitizers if they must enter the home. So these are some of the precautions that we can take. Masks, if there's someone who has a flu-like illness and we're not sure. So we're getting the doctors on board for all of these homes to triage. So the homeowners, we advise the homeowners, if you see some of these symptoms, we don't need to flood the health centers and the public system just yet. Just make contact with your local doctor and get some information.
And as with pregnant women, as you would have seen with Zika, where right. there were implications to the unborn baby and yes. thereafter, can we expect anything like this now with this COVID-19?
Great question. So, Disha, so far we've had a little limited research because, it's been a short time, maybe 2-3 months so far with exposure to the world and this particular virus. But so far, according to the Royal College of ONG, that's one of the go-tos, so to speak, when it comes to this sort of thing. And there haven't been any major documented cases of miscarriages and preterm deliveries and that sort of thing with regard to vertical transmission from mother to infant. So we can't say that there's going to be any particular problem just yet. But again, limited data.
What about with all the chemicals that are in the air right now, with people feverishly trying to sanitize surfaces, the Lysol and so on, with pregnant women around breathing in all of that? Is that okay?
Well, I wouldn't be terribly concerned about them unless they were sitting over the containers and directly inhaling the fumes. When we're talking about disinfecting, we're not talking about using very large quantities. It's just enough to wipe down the surface, get it moist, and allow it to air dry. And just to mention for the pregnancy, as Dr. Hinds said very accurately, there's actually no evidence that the pregnant women who get coronavirus do any worse than non-pregnant women. In fact, from the small amount of data that has been published on pregnant women, of the hundreds of papers that have been published, it seems that pregnant women and their babies actually do quite well. And interestingly, the data suggests that children who acquire the illness can actually do quite well. I was just reading a case report of a 6-year-old child who was one of a family of 6, and everybody got the coronavirus, the child included. He remained completely asymptomatic, even though he developed pneumonia on chest x-ray. So children and pregnant women can actually do quite well. But on first principles, we certainly want to treat them as a high-risk group because there may be much more that's out there that we think we know that we don't know.
Can this virus mutate?
All viruses can mutate, yes. The question is, when does a virus mutate? How long does it take? And in what ways does it mutate? And does it mutate in any way that is clinically relevant? So in other words, is it a mutation that's a harmless mutation and just something that's changing on the surface of the virus? Or is it something that's going to change its virulence or how severely it's going to affect the body that it infects?
One of the things that people have been saying and you've been hearing about is that warmer climates, you're in a better position with warmer climates. Is that true?
So a lot of what's been coming out about warmer climates is based on the Spanish flu of 1918. And the reason for that is because during that, that was one of the biggest pandemics in the world. About 500 million people were affected, 50 million people died around the world, over 700,000 people died in the US. During that pandemic, what it showed is that during the warmer months, it started to curtail. The pandemic started to go away. So that's one of the reasons they're piggybacking off of that, the Spanish flu, and thinking maybe...
So it's just based on that history and
not just based on that history, but scientifically. Remember, I said it has a coat that's fatty, so that fatty coat can make it less able to survive in the air, in sunlight, in UV light. So when it becomes warm and sun comes out in summer, in the temperate climates, it may be less likely to survive, similar to the Spanish flu.
All right, that's I suppose good news for us in a...
Yeah, and during the Spanish flu, they actually nurse persons outside, which when you nurse persons outside, it helps with the rate of refreshing of the air. So you have better outcomes when you're able to go outside rather than stay indoors, like in times when it's early spring, versus late spring versus summer.
Are there any other myths that you all have been hearing that you think need to be debunked?
Oh yeah, I mean, definitely. I mean, there are lots of myths, more myths than you probably have time for.
Yeah.
I could probably grab a few of the more interesting ones or the funny ones. I heard one that, so people, of course, we've been obviously saying that one of the things that we use to disinfect is alcohol. Hand sanitizer is more than 60 to 70% alcohol, or surfaces could be cleaned with alcohol. So some people got the idea that alcohol kills the virus. So people have been asking, if I drink large quantities of very strong alcohol, is that going to kill the virus in my system? And
It's
obviously
not going to work
the
if you
answer is
take
no.
it that way.
It certainly won't work. The body's much more complex. It might clean the mouth from any virus particles there transiently, but then they're going to grow back. So no, that's not an effective one. Another one is actually that, and I'm going to count this as a myth right now because there's no data for it, that this virus doesn't survive well in warmer climates. That's extrapolated data, as Doctor was saying, not only from the Spanish flu, but also from the seasonal flu that happens every year. We know that in the colder months there's greater transmission. Not too sure if the virus necessarily doesn't live so long, in so much as people probably spend less time huddled up indoors during the warmer months. They're probably outside more, and that means that there's probably less person-to-person spread. So that's another thing that I'd say is probably, that may well be a myth, especially since this is a new virus, and those characteristics would affect viruses that are around and people have immunity to, but there won't be herd immunity to this virus. So we may not see such a difference in this temperate climate.
Okay, any closing comments?
Yes. So, one of the things I think Dr. Rahman just touched on was the influenza virus, and the reality is that this is the season. This is the flu season, exactly, and we've had several cases of, I think a few weeks ago we had about 40-something deaths from the influenza virus, and it's something that can be avoidable. We do have the vaccination available, and the thing is now that we have a confounding presence of incidence and prevalence of the influenza virus, but then we're wondering if this is influenza virus or is this coronavirus. So my recommendation to all is to get the vaccination, discuss with your local doctor whether the influenza vaccination is for you, and take it appropriately.
Well, thank you.